Let's close our eyes and we'll take some deep breathing. Inhale. Exhale. Inhale. Exhale. Focus on your third eye chakra. Keep your back straight. As we inhale next time, we'll chant the Lord Dharmatri mantra together. Inhale. Om Namami Dhanvantarim Adi Devam Surasure Pandita Pada Padmam Loke Jararuk Bhay Mritunasham Dhata Ramisham Vividho Shridhinam. Now gently start to rub your palms. Apply on your face. Now, looking at your palm, you can open your eyes. Okay, can we start the test for 5-10 minutes? Have we all gone through the points, everyone? Can somebody tell me where is the location of Tilarth Kala Marma? Which is Tilarth Kala Marma?
Yeah.
Middle.
1 minute.
Okay. Which is Lakshmi Marma? Lakshmi Marma?
Yeah.
No.
It's a cheekbone, sir. Cheekbone.
Below the cheekbone.
Below the cheekbone.
Okay.
The camera is not working, sir. So sorry for that.
Sorry?
My camera is not functioning. I'm actually logged in through my laptop today.
Yes.
There is
Okay.
challenge.
Others, please keep your videos on and participate in the quiz. All
I'm
of
trying
you are
to
looking
speak.
for the recordings. I need to know how much you are actually going through it now. Which marma represents the fire element? Which marma represents the fire element? You can open the mic and tell and mute the mic again. Which marma represents, or you can just type.
Chunambu Kalam.
Chunambu Kalam. Anybody else? Any other answer? Okay, let me do
Lakshmi Marma.
sorry? Lakshmi Marma? For fire element?
Chunambu Kalam.
It is Chunambu Kalam, which is 2 finger above my ear. Okay.
Yes.
From my Which element represents the water element? Water element?
Bidur Marma.
Anybody
Bidur
else
Marma.
answer? If you can type, please do type also.
Vidur Marma.
Vidur Marma.
Okay. Location of the Bidur Marma?
Behind the ear.
Behind the ear, where the jawbone is ending.
Ending, yes.
Can we know 2 Marma points for emergency situations?
Yes. Yes, sir. This is, sir, the Kutri Marma also.
Kutri Marma
And this
One year.
just between the about the lips, the center point of lips.
Yes, what is the name? Okay. Which Marma represents Girikaran Bayu? Which Marma represents Girikaran Bayu?
Urdhagandha.
Nose one, yeah.
Urdha Gandha.
What is the location of Uddagandha?
That's the first point on your it's about the
Nose.
nose and the eye, the joint. It rules the joints.
No, it's straight.
So if we
Upper
divide the
portion.
nose in 3 parts, okay? First part, second part, third part. So it is just on this
Above,
side of the
near
person.
the
Yes.
ear. Yes.
Yeah.
Near the eye.
Okay. Tell me 2 points which will help you with the insomnia.
This one.
The eyes one and the
The
cheeks
Kapol
one.
Madhya. Kapol Madhya.
It's
Kapol Madhya.
Kapol
Apol
Madhya.
Madhya and Ashru Marma. Perfect.
Ashru.
Ashru and Dhruv.
What is
Upward
the
Madhya.
stimulation method for Nasa Mool?
You just lift it with your thumb.
And down. Lift
Nasa
and
Mool stimulation method.
Lift it with your thumb, sir. Lift it with your thumb and just keep it up.
Wrong. Everybody wrong.
No need to
Sorry,
swim.
Nasa Mool is the top point.
Hold and upward.
No
Sorry,
need
that
to
is
swim.
Nasa
Upward.
Agra.
Upward.
Sorry,
Upward
sir.
is middle finger.
Upward.
Stimulation. There is no
No
stimulation for
stimulation. No
Nasa Mool.
stimulation.
Spiral movement.
The one
No.
that we said was for
No,
Nasa
no, no,
Agra.
no, no.
So I'll get
There
a
is
clear.
no stimulation method. There is no stimulation needs to be done on Nasa Mool.
Yeah,
Nasa
sorry.
Mool should be left alone. It is
It was
just
for Nasa Agra.
Nasa Agra is this.
Yeah, you have to lift
Nasa
it up.
Madhya. So this
Nasa
one
Mool.
is the Nasa Mool. So there is no stimulation to be done for Nasa Mool because
No stimulation.
with Tilartha Kalam it is stimulated on its
Yeah,
own.
Yes, yes. Sorry.
Okay. Tell me a point which will help you with the knee pain.
Even Urdhagandha will help you, sir.
Under the eyes.
And
Under the
and,
eye, yeah.
and Bratma. Perfect. अभी जो हमने देखा था 3 पॉइंट पहले मैंने बताया था कि आपका जो चुनांबू कालम है चुनांबू कालम ओके दिस रिप्रेजेंट्स द अपर बॉडी चेस्ट के ऊपर ओके जो शंख मर्मा है दैट रिप्रेजेंट्स द मिडिल बॉडी द स्टमक एरिया ओके एंड द विदुर मर्मा वाटर एलिमेंट so water element is controlling the lower body including our genitals, our legs, our knees, our thighs, our calf, all controlled by mostly heavily controlled by the water element. ठीक है तो ये चीज हमें जानना जरूरी है कि नी पेन के लिए नी पेन लेग्स पेन के लिए लेग पेन अभी एक जैसे this is like a pandemic in the world. Okay, people are suffering with knee pain too much. How to stimulate Nasa Mool? हम बताएंगे, आप बताइए. लेकिन जो क्वेश्चन हम बात कर रहे हैं उस पे पहले उस पे फोकस कीजिए ताकि we do not divert. ठीक है, तो मैं ये बता रहा था कि जैसे leg pain is like a pandemic in this today's world. Okay, तो आपको ये points याद रखने हैं कि जैसे नी के लिए स्पेसिफिकली ऊर्ध्वगंधा and Bratma है, but Vidur Marma, which is controlling the water element, can be also very helpful in treating the knee pain or pain of the legs. Okay, so all the points which controls the water element, and water element controls the kidney and urinary bladder. तो ये जो हमारा वाटर एलिमेंट है वो किडनी और यूरिनरी ब्लडर को कंट्रोल करता है इसीलिए लोअर बॉडी में इसका इफेक्ट बहुत ज्यादा है तो मैंने जैसे अभी ये चीज अभी बोला कि आपको कि द वाटर एलिमेंट इज कनेक्टेड टू द किडनी एंड यूरिनरी ब्लडर ये चीज इसको समझने में थोड़ा डिफिकल्ट हो रहा है इज देयर एनीवन हु इज not able to understand this very well कि सर ने तो बोल दिया but there is no actually I'm not able to understand any connection between these two and is there anyone please speak up बाद में आप क्वेश्चन पूछोगे ऐसे कुछ टाइम पे क्वेश्चन पूछोगे जो it becomes a very difficult for me to answer रात के 12 बजे मैक्स करके बोल रहे सर रिकॉर्डिंग कहाँ है तो अभी मैं क्या करूँ रात के 12 बजे
That day you showed us the 3D version and it showed how the energy flows all those points. Okay, when you stimulate this point how that energy channel goes through your body and where it ends that day you showed us very clearly so I'm kind of relating to that 3D version.
Okay, so we can say all 5 elements are basically controlling some or other organs तो ये चीज हमें अभी इनिशियल लेवल पे there could be some acupuncturist, there could be some acupressure specialist or any other or maybe Ayurveda ओके तो आप लोग शायद जानते होंगे, लेकिन बहुत लोग ऐसे भी है जो जानते नहीं है। तो हमें थोड़ा सा एक स्टेप आगे जाके हमने 5 एलिमेंट के बारे में सीखा, तो हम थोड़ा सा देख लेते हैं कि ये 5 एलिमेंट कौन से ऑर्गन्स को हेल्प करते हैं, ठीक है, और इट इज रूलिंग दिस ऑर्गन्स बाय व्हिच एलिमेंट। तो जो पहला जो एलिमेंट है वाटर, वाटर इज कंट्रोलिंग द किडनी एंड यूरिनरी ब्लैडर बाय लॉ। Is my voice very low?
No, that's fine, sir.
No, sir,
Absolutely.
fine, sir.
Absolutely fine.
So actually
Right.
somebody's mic is on, so that is creating some
Sorry,
static
come again.
noises. Somebody's mic is on, so while you're
Yeah,
talking,
it is on the
some
road
other-
basically. In the road, there are some mics going on because of some festival in my.
No, not that, not your background voice, but some other.
some
सर
other person.
अदर पार्टिसिपेंट्स के जो वॉइस है ना वो अनम्यूट है, तो
So-
आपका
नहीं
voice
देखिए,
clear
अभी
नहीं आ रहा है।
जो थोड़ा सा क्विज चल रहा है ना, इसकी वजह से थोड़ा सा असुविधा हो सकती है, बट हम जैसे उसको बंद ही रखेंगे मैक्सिमम टाइम अभी, बिकॉज वी आर डिस्कसिंग। तो थोड़ा सा अभी हो सकता है थोड़ा बहुत, थोड़ा सा एडजस्ट कीजिए, ठीक है, बट इट विल नॉट बी फॉर लॉन्ग टाइम।
Sir, I have a question regarding the kidney point.
Ah.
So, sorry, the urinary bladder. So it's also helping us in like UTI and
Yes.
like all those problems.
Yes,
Okay.
it will. So
Thank you,
UTI के लिए we have very specific point for the UTI or the urinary bladder. But अभी हम बहुत ही बेसिक लेवल पे ये सीख रहे हैं कि कौन सा एलिमेंट किस ऑर्गन को रूल करता है, ठीक है। तो इससे हम बहुत सारे प्रोटोकॉल्स बना सकते हैं बहुत इजीली, ठीक है। तो जैसे मैंने अभी पहले बताया कि जो वाटर एलिमेंट है दैट इज रूल्ड द किडनी एंड यूरिनरी ब्लैडर एंड कंट्रोल्स द लोअर बॉडी। जो एयर एलिमेंट है, air element which is poigai column, okay, poigai column controls the air element and the air element controls the liver and gallbladder. तो आप इसको नोट डाउन कर लीजिए ताकि बाद में जो नहीं जानते उसमें डाउट ना हो, और ये चीज आपको बेसिकली याद कर लेना है थोड़ा बहुत, क्योंकि ये बहुत ही ज्यादा काम आने वाला है एज वी मूव अलोंग। सो द एयर एलिमेंट कंट्रोल्स ruled by the poigai column and the air element will be controlling the liver and gallbladder, okay. Now the fire element which is controlled by the chunambu column is controlling the heart and small intestine. The shankha marma which is controlling the earth element will be effective in two organs which is spleen and the stomach. Shankha marma will help with your spleen and the stomach. Then we have the apang marma. So apang marma is controlling the metal or the ether element. Metal in terms of the acupuncture or the traditional Chinese medicine. हमारे इंडियन शास्त्र के हिसाब से इसको हम एयर एलिमेंट बोलते हैं, ठीक है। सो दिस इज कंट्रोलिंग द लंग एंड द लार्ज इंटेस्टाइन। नाउ टू मूव even deeper, okay, to move even deeper, I'll go a next step. Now the kidney and the kidney specifically controls all your bones. So any problem with your bones, you have to include the kidney without any doubt, wherever the problem is. Now if there is a problem with your ligament, tissues, nerves is not, but ligament and tissues, okay, tendons, then it is mostly the liver which is controlling all this, okay. Then we have the heart. So heart is controlling the fire which is controlling the vision, okay, your vision, or the speech, or you can say also how much you talk. Like if you're talking too much, then we can say that your heart energy is too much, okay. Then we have the earth, spleen. Okay, spleen and the stomach. So spleen controls the muscles. Spleen controls the muscles. And the lung controls the skin. Now, I have a question for all of you, that if there is a pain on my knee, the pain is basically in the bones or in the muscles or in the joints or in the ligament or tendons, or it could be what it could be. Where is the problem?
Ligaments.
Yes. Is it only one? Osteoarthritis के बारे में आपने सुना है? और osteoarthritis.
That's in the bone.
Yeah.
Almost all elements.
All the elements it could be possible. ठीक है? तो ये एक चीज है कि जैसे आप कोई भी प्रॉब्लम आप ट्रीट कर रहे हो ना, तो कोई भी ऐसा चीज नहीं है जो मतलब that is why we say we have to see the person as a whole. We cannot just treat individually something. अगर आपका सर दर्द है तो आपको सिर्फ सर दर्द का ही इलाज हम दे रहे हैं, और we are not seeing the person. If there is a problem in the stomach or somewhere else, then it is not a complete treatment. Okay, so the idea is that here we have to be able to diagnose. ठीक है, तो आप जैसे ये 5 पॉइंट पे हाथ रख के पहले पल्सेशन को फील करोगे, और ये 5 पॉइंट बताएगा आपको कि बहुत क्लियरली कौन सा एलिमेंट में आपको प्रॉब्लम है. ठीक है, और अभी पल्स जो है वो पल्स, इफ इट इज वेरी स्ट्रॉन्ग पल्स और इट इज अ स्लो पल्स, दैट इज अ कंपैरेटिव स्टडी. तो आपको क्या देख के, ठीक है, whenever you touch any pulse, any marma point, what kind of pulsation you feel, that you have to, as you practice more and more, you will remember कि ये normal pulse है. जो abnormal pulse है उसके बाद आपको बहुत easily पता चल जाएगा, because you know what is the right amount of pulse. और सिर्फ खुद पे मत देखो, दूसरों लोगों पे भी ट्राई कीजिए. Otherwise there may be problem with your all the elements somewhere or the other. Okay, ups and downs, because what if one element is affected, all the elements will be affected if it is not taken care properly. So check others as well and have a very clear idea what could be a normal pulse and what not, and based on that you'll be easily able to find out ki which marma or which element is affected, or based on that you can exactly see some other places also. ओके, जैसे टंग में भी आपका 5 एलिमेंट्स का डायग्नोसिस हो जाता है. ओके, आंखों में भी आपके टंग 5 एलिमेंट्स का डायग्नोसिस हो जाता है. सो यू हैव टू बी एबल टू लर्न different kinds of diagnosis, and there are many. Okay, so we have a diagnosis in our stomach, then we have a diagnosis on our ears. So there are many ways to diagnose the our problems. So we have to be very sure कि which method you know, and how can we confirm that this could be problem with this, and how fast we can treat. If you don't know, then simply go by protocols. ठीक है, तो आप जैसे आपको अगर नी पेन के बारे में पता नहीं चल रहा है, समझ में नहीं आ रहा है कि which exactly it is the problem with the knee, bone or the ligament or the muscle, just go for everything, but giving more importance to the points which are related to the knee pain. अभी जैसे मैंने डायरेक्ट पॉइंट बताया कुछ, जैसे ब्रह्मा है, ऊर्ध्वगंधा है, and Vidur Marma, because Vidur Marma is the one which is controlling the lower body. Which organ? You tell me. Fire element, it controls what? As I said, fire controls. I'm not able to remember very clearly, but it will control your speech, okay, and it will control your vision. These two I can remember. I'm not exactly at this moment. Somehow I'm not remembering which organ directly it is connecting.
So you said heart controls fire.
Sir, eyes are controlled by liver, sir, according to TCM.
Sorry, come again.
Eyes are controlled by liver.
Eyes are controlled by the liver, but there are some effects. Okay, there are some effects shows on the eyes as well, the vision. not the physical organ. The vision is controlled by the fire, but the organ is controlled by the liver. Okay, so I'll tell you if there is anything about the heart, about the fire element. I'll tell you again. Okay, so this is now.
गलती से जेल में आ गई यार.
Yes, tell me again.
ले.
Okay. Now let's move to points on our hands today. Give me just 2 minutes. I'll start the.
Sir, I have one question about when you are activating the point. So you said clockwise is removing the, like, reducing
Cleaning.
the energy.
Clockwise is cleaning.
Clockwise is cleaning.
Anti-clockwise is giving the strengthening.
Giving the strength. Okay. Thank you, sir.
Thank you. So in our palm, if we take a straight line between our middle finger and the ring finger, okay, so in this line we have 3 marmas, but before we find out, we have to understand how the measurement, how can we measure this area. Okay, aapka palm ka, how many fingers you have in your palm. Okay, if you measure with fingers, how many fingers will be your length of the palm or the width of the palm?
I think it's all the 5 fingers, I think, sir. It's all the 5 fingers.
Yes, 5 are
No,
coming,
it
yeah.
will be 6 fingers.
Oh, is it 6?
4.
Oh, okay.
Right.
Exactly.
6.
4 and 2, 6.
Yeah.
Okay.
Okay.
So now 1, 2, 3, 4. Still not coming.
I'm getting 5, huh? 6.
It is 6.
Till the end, okay. Where it starts, the wrist. Okay. Okay.
So between the first 2 point, 1 point, between the second 2 and third 2, these 3 points are called Tal Hriday Marma. Tal Hriday. Okay. So now this is Tal Hriday 1, this is Tal Hriday 2, and this is Tal Hriday 3. Tal Hriday 3 is also called Ulangai Vellai. Okay. The third one. Now, Tal Hriday Marma 1 controls the upper body, middle body, and this is lower body. Okay. Now, as the name suggests, okay, Tal Hriday. What is the meaning of Hriday?
Heart.
Hriday is heart. Okay. So it is one of the best point for your heart problems. Okay. Best for heart issues. तो आपको याद रखना है जो which is very closely connected to the heart is the middle one. One in the middle will works the best for your heart. अगर आपको सर में कुछ दर्द है तो आपको जो the first one you can use, and the lower one is used for the pain in the lower body. Now the lower one specifically here, which I can show you, which is somewhere here. Okay, if I compare this palm with my foot, so this area becomes your heel. Okay, heel and ankle. So I have seen many times that putting 2 points in this, 2 acupuncture needles in this point can cure the heel pain immediately. Like within few seconds, you can cure your heel pain if you put needles in these 2 points. Okay, so even if you with your Marma stimulation method, if you do stimulate this area, it is going to help a lot in the lower body, including heel pain, foot pain, ankle pain. This area, it works the best. So this is the use of indications of Talahridaya Marma. Now we'll come to the back side.
सर तलहृदय 3 शाटिका पेन भी आ जाएगा इसमें?
हाँ, साइटिका पेन थोड़ा सा मुश्किल है इससे ठीक करना, आप कर सकते हो यूज, ठीक है, ऐसा कोई नहीं, रेस्ट्रिक्शन नहीं है, बट डायरेक्टली इट विल नॉट वर्क टू मच।
लाइक कि वो पेन जो है वो एंकल तक जाता है अपने लोअर बैक से उठकर।
साइटिका पेन के लिए हमारे पास पॉइंट्स है, वो उसका हम डिस्कस करेंगे आगे जाके।
ओके ओके।
Now there is a point at the back of my palm, which is between my ring finger and middle finger knuckle. Okay, and this is a little bit towards the middle finger. Okay, little bit towards the middle finger, in between the knuckles. So this is called Mosi Piral Guy. Mosi Piral Guy. Mosi Piral Guy. Okay, so what we can use this for paralytic hands.
Piral Guy. Right, okay.
Mosi Piral Guy for paralytic hands and also for self-defense. Okay, तो हाथ में जो भी इश्यूज है इस एरिया में, ओके, अगर कोई हाथ नहीं खोल पा रहा है तो इस मर्मा पॉइंट का स्टिमुलेशन करके आप बहुत जल्दी किसी का हाथ को ओपन कर सकते हो, ठीक है। So if you have patients like this, you have to know how to, and this is a very sharp, painful point. I will show you how to stimulate this after I finish the theory part. Mosi Piral Guy. So this is obviously going to work very nicely in this area. Okay. The next point, which is, so this is my, oh, sorry. This is the point which is on my thumb. Okay. So ये आपका thumb का जो interphalanx joint के नीचे जो ये वाला बोन है, so, ठीक है, ये जो बोन है इसमें आप point number 1, point number 2 and point number 3. So again here 3 points, and which are called Kabuli Kalam. Kabuli Kalam. तो हमने जैसे पहले बताया था आपको कि बहुत सारे पॉइंट्स होते हैं जिसमें आपको कालम का यूज दिखेगा, ठीक है। सो देयर दिस पॉइंट्स आर वेरी वेरी पावरफुल। तो आप क्या करोगे, इसमें 3 fingers you have to place and you have to stimulate together at the 3 points. So Kabuli Kalam 1, this is 2, and this is 3. Again the same formula, upper body, middle body, and this is lower body.
So it starts from the middle of the thumb, is it, sir? The middle bone of the thumb, then towards your palm area,
where the phalanx will end.
Okay.
Okay, there. So this is one particular bone.
Right.
So if I show you just a minute.
Oh yeah, that'll be nice.
So this is the bone, okay?
Right, perfect, sir. Brilliant. Okay.
1, 2, and 3. Okay.
Great.
This is the Kabuli column.
It's Kabuli, Li, right?
Hmm. काबुली कालम। तो जैसे ये हमने दिखाया एक पॉइंट है, ठीक है, दिस इज वन बोन, बट दिस फॉर्मूला दिस इज बेसिकली यूज्ड इन द मर्मा शास्त्र, बट एक्यूपंक्चर में इसी फॉर्मूला का हम यूज करते हैं दूसरे बोन के ऊपर, और इसी सेम मेथड वी कैन यूज हियर एज वेल। तो आप देखोगे कि ये दो बोन, कोई भी बोन बॉडी का में ले सकते हो। जैसे ये एक बोन हो गया, ठीक है, इस बोन का भी जो अपर पार्ट है, मिडिल पार्ट है एंड लोअर पार्ट है, तो इसको हम जैसे अपर बॉडी, मिडिल बॉडी एंड लोअर बॉडी के हिसाब से इसको ट्रीट कर सकते हैं इस एरिया में। तो हाथ के रिस्ट के सामने आपके जो भी पॉइंट्स है वो आपको जो अपर बॉडी है उसमें बहुत ज्यादा काम आ सकता है। तो आपको फाइंड आउट करना पड़ेगा, वो फाइंड आउट करने का तरीका बहुत अलग अलग होता है, ठीक है। तो अभी इस एरिया में बहुत सारे और भी पॉइंट्स हैं एक्यूपंक्चर के हिसाब से, तो आपको एक आइडिया चाहिए कि कौन सा पॉइंट जो है सर से क्लोज रिलेटेड है आउट ऑफ ऑल दिस, एंड व्हिच पॉइंट आई कैन यूज टू ट्रीट द प्रॉब्लम्स इन माय हेड if there is any problem on the stomach region. Okay, so so we say that there is a point here which is triple Warmer 6. Okay, this point is very heavily used for constipation. तो ये इसको बोलते हैं हम like a miracle point for constipation on the back of the palm. ठीक है, तो आप कोई भी बोन ले लो और उस बोन के जो अपर पार्ट है, मिडिल पार्ट है और लोअर पार्ट है, उसको हमें देख के उस एरिया में कौन से पॉइंट्स है और उस पॉइंट को एक पर्टिकुलर इशू के साथ हम कैसे जोड़ सकते हैं, उस रिलेशन को आपको धीरे धीरे आप जानोगे कि कैसे उसको किया जाता है। और भी हाथों में जो पॉइंट्स है उसको मैं आई विल शो यू इन द नेक्स्ट पॉइंट्स। तो अभी हमने एक चीज यहाँ पे नोटिस किया कि हमारा जो ये वाला एरिया है, अभी जो आप शायद मैं रेड से मार्क करूंगा, सो दिस एरिया बिकम नाउ वेरी इंपॉर्टेंट जंक्शन बिटवीन दिस टू फिंगर्स, और दोनों पॉइंट का जंक्शन, ये जो जंक्शन है विच इज शोइंग यू द लोअर पार्ट ऑफ द बॉडी। तो इसका यूज काफी ज्यादा होता है लोअर बैक पेन को ट्रीट करने के लिए। तो इस पॉइंट को आप थंब से प्रेस करोगे, जो जंक्शन है, तो आपको लोअर बैक पेन को बहुत जल्दी क्लियर कर सकता है, ठीक है। इसको एक्यूपंक्चर और मास्टर टंग एक्यूपंक्चर में इसका काफी ज्यादा यूज होता है इस पॉइंट का, और इसका स्टिमुलेशन हमने जो काबुली कालम का, दैट आई विल शो यू इन सम टाइम। Now come to the front side again. Here we'll need the other system. तो आपके हाथ के बीच में इसको आपको दिखाना पड़ेगा ऐसे, एक चैनल है पेरिकार्डियम, हम इसे पेरिकार्डियम चैनल बोलते हैं या ब्रेन चैनल है, ठीक है। तो ये दोनों जो नाम है पेरिकार्डियम एंड ट्रिपल वार्मर, अभी जो मैंने दिखाया था ट्रिपल वार्मर, ये थोड़ा सा डिफरेंट है। इसके बारे में जो नहीं जानते उसको मैं बाद में कभी बोलूंगा, एक्सप्लेन करूंगा, बट this point the pericardium, okay, the red channel which is you can show, which is starting from the middle finger and ending very close to the nipples, this is we call pericardium and or the brain meridian. तो ये जो पॉइंट है इसका, ये हाथों के एकदम बीच में जाता है, ठीक है, बीच में से। फिर आप देखोगे there are few other points like lung, which is exactly going on the upper side, the upper radial side. So it is going through the radial side. And then we have the heart channel, which is going through the ulnar side. ठीक है, तो अभी ये तीनों पॉइंट, this 3 point on the wrist, 1, 2 and 3, these 3 points are called Manibandha. Manibandha. इसका यूज हम काफी यूज करते हैं नेक पेन के लिए। तो अभी हमने एक चीज सीखा कि जैसे आप एक पर्टिकुलर बोन को, कोई भी एक बोन ले लो, छोटा हो ऐसे या बड़ा हो ऐसे, ठीक है, सारे जो बोन्स है, जो उसका फर्स्ट पार्ट we can use for the upper body, this part we can use for the middle body, and here we can treat the lower body. Same 1, 2 and 3. तो अभी ये सेम एप्लीकेशन, सेम मेथड, ठीक है, ये थोड़ा समझना आपके लिए, एक्सेप्ट कर लेना ज्यादा इजी है rather than trying to understand it too much at this moment. ये जो पूरा हाथ देख रहे हो, सेम फॉर्मूला कैन बी अप्लाइड हियर ऑल्सो। मतलब कि आपने इस हाथ को मान लिया अपना सर, इसको मान लिया अपना चेस्ट रीजन, ये आपका डायफ्राम, ठीक है, सॉरी नॉट डायफ्राम बट नेवल रीजन, ये बिलो द नेवल रीजन, और ये जेनाइटल एरिया, ठीक है। तो ये आप मान के चल सकते हो कि हाँ, कि अगर सर में दर्द है तो हम अपने उंगलियों में कुछ पॉइंट्स को लेके, बाय टेकिंग सम पॉइंट्स ऑन आवर फिंगर्स, वी कैन ट्रीट द हेडेक। नाउ इफ वी आर taking any points in our wrist, it is definitely going to help on our neck region also. But now I will not explain or make it very complicated how this happens, but we will definitely learn more. Ki if you find blue or green color veins for any woman in this area, तो आपको पूछना है उनको कि आपका कोई पीरियड्स रिलेटेड इशू है कि नहीं, मेंस्ट्रुअल डिसऑर्डर्स में कुछ भी है कि नहीं, जैसे टाइम पे नहीं होना, ठीक है, या तो डेट पीछे होते जाना, या तो एक्सेसिव ब्लीडिंग होना, या तो सिस्ट होना, या तो कोई व्हाइट डिस्चार्ज होना, कोई भी अगर मेंस्ट्रुअल डिसऑर्डर है तो उनको यहाँ पे ब्लू और ग्रीन कलर का वेन्स दिखेंगे। तो ये एक डायग्नोस्टिक टूल के हिसाब से आप इसको यूज कर सकते हो, एंड दिस 3 पॉइंट कुड बी ऑल्सो used for treating the menstrual disorders, which is we say Manibandha. Next point. Now, many of you have seen probably doing what do you call it, pulse diagnosis. Okay, तो ये 4 पॉइंट्स है बेसिकली हाथ में, रेडियल साइड में, जहां पे हम पल्स को चेक करते हैं। जो आयुर्वेद प्रैक्टिशनर्स है, they will consider these 3. Okay, they remove, basically they do not place the fingers on the first one, but we acupuncturists take these 3, ठीक है। तो जो आयुर्वेद के हिसाब से this one is the Vata, this one is the Pitta, and this one is the Kapha. Means by checking the pulse in this area, और इस एरिया में आपका पल्स जो है वह बहुत ही करेक्ट पल्स दिखाता है, एंड दिस इज बीन यूज्ड फॉर एजेस टू चेक योर पल्स एंड द कंडीशन ऑफ बात, पित्त एंड कफ, ठीक है। तो जैसे बोला जाता है कि बात है which is mainly rule the upper body, पित्त controls the middle body and the कफ controls the lower body. तो ये जो कफ है ये सिर्फ एक डायग्नोस्टिक एरिया नहीं है, दिस इज नॉट ओनली अ डायग्नोस्टिक एरिया, बट दिस इज also Marma point. Okay, so and it is called Kapha Nadi मर्मा, ठीक है, सिंपल कफ से कफनारी मर्मा। और इसी को अगर हम स्टिमुलेशन करते हैं तो कोई भी जो कफ डिसऑर्डर्स है तो उनमें बहुत ज्यादा हेल्प मिलता है। व्हेनेवर देयर इज अ प्रॉब्लम विद कफ डिसऑर्डर्स, कैन नाउ समबडी टेल मी व्हाट आर द काइंड ऑफ कफ डिसऑर्डर्स? Is there anyone who are from the Ayurveda, practicing Ayurveda, and can tell me, share with all of us what kind of disorders can be coming from the kapha-nari issue?
Sir, cold, cough, overweight.
Very nice, very nice. So weight gain is something which is related to kapha dosha. ठीक है, तो आप जैसे weight loss protocol बना रहे हो, whenever you're making a weight loss protocol, don't forget this point. This is very, very powerful. Okay. Now, can somebody tell me what is the length of this area from the wrist to the elbow? How many fingers? Everybody must find out and share in the chat box.
16 fingers. 4.
Can check it out and tell me.
8, 12,
14, 12.
So I think 16, sir. 15 or 16.
17.
12,
Oh my,
12.
oh my God. 14. See, anybody coming 10?
12. 4.
14, sir.
Okay. So 18. My God.
16. 16, sir. 15 to 16, maybe.
आपने वो सुना है ना, कानून के हाथ लंबे होते हैं, तो जो 18 fingers वाला हो, definitely he can go to police probably, right? So according to books, this area is 16 fingers.
16.
Okay, 16 fingers, but generally it is very difficult to find 16 fingers. आप measure नहीं कर सकते, ठीक है, उंगलियों से measure करना थोड़ा difficult होता है 16 fingers. तो जो which are the locations, okay, that location, to find out the location by measuring with fingers becomes little difficult. So what we do, we take a random method where we actually divide the area in 2 parts. So if this is the middle area, middle line, then we can think that this is 8 finger area, and we'll take one more point which is 4, and this is 4. Okay, so the kapha-nari marma is obviously somewhere here, and then we have a marma point which is on the 8th finger, after the 8th finger, okay, on 8th finger, but not in the front side, it is on the back side. So, and this is called the theta marma. Now theta marma is going to be helpful in lower arm pain, also elbow pain. And my teacher used to say, if you are losing the color of your skin in this particular area, okay, in the lower forearm, then also this marma could be helpful. Losing color of skin. Okay, so this can be used. Now it is on the radial side, but on the back of the hand, not on the front side. So I will exactly show you by theoretical method, practical method. Last one for today. Now we have a point on the elbow area, which is point 1 exactly in the middle, and then if I measure 1.5 finger, okay, so point number 2, and we have a point number 3 on this side here in the middle. So this 3 marmas are called purpur, मर्मा, कुरकुर, यस, कुरकुर मर्मा। तो आपको कब यूज करेंगे? ऑब्वियसली फॉर टेनिस एल्बो। ठीक है, तो इसका काफी ज्यादा यूज होता है टेनिस एल्बो पेन में। और क्या इस्तेमाल कर सकते हो? एनी आइडिया? So this is going to be, these three marmas are also going to be very helpful for your headache. So I'll show you now this marma. I'll little show you how to exactly see. It is going to be helpful for, generally we say ki according to the energy principles, it could be helpful around the stomach area, near the navel area, but we can see some effect on the headache related issues also with this point. So ये जो 3 पॉइंट है, इसमें आप एक थंब से यू शेप की तरह स्टिमुलेशन करोगे। ठीक है, यू शेप में। I'll show you the stimulation now. Everybody keep your audios off. I see many people are keeping the camera off and busy with other things. Okay, so which is not going to be very interesting for you. But आप भूल जाओगे, आप जब प्रैक्टिस नहीं करोगे तो भूल जाते हो। और सबको लगता है कि, मैंने देखा है, सबको लगता है कि जैसे वीडियो देख के वो सारा कुछ सीख लेंगे। नहीं होता है। ठीक है, इफ यू आर नॉट फोकस्ड, दिस इज अ स्पिरिचुअल नॉलेज, इट इज ओनली कैन बी कमिंग थ्रू द ग्रेस ऑफ द आवर गुरुज। तो आप थोड़ा सा अगर थोड़ा सा रिस्पेक्ट के साथ अगर नहीं करते हैं ये सारी चीजें, तो हम हमेशा बचपन से एक चीज बोला जाता था कि लाइक आप सो के अगर पढ़ रहे हो तो आपको वो चीज कभी आपके दिमाग में नहीं जाएगा, है ना। तो ये सारी चीजें हमें बचपन से बताया जाता है, लेकिन हम बड़े होके भूल जाते हैं ये सारी चीजें। ओके, म्यूट प्लीज एवरीवन, कीप योरसेल्फ म्यूट। ओके, तल हृदय मर्मा। ओके, फर्स्ट वन। सो this is the stimulation method where we place 3 fingers and create zigzag motion. This is method number 1. Here what we are doing, we are placing the pad of the fingers and then moving sideways. Now कोई भी कंडीशन अगर acute condition है, acute condition means emergency conditions, then we move it fast. Okay, if it is a chronic condition, then we move slow. Right? Is there anybody who doesn't know any of the difference between chronic and acute condition? Is there anyone who don't know what is acute and chronic? तो आप मुझे ये छोटी छोटी चीजें आप पूछ सकते हो ताकि आपके मन में डाउट ना रहे इन सब चीजों के बारे में। ठीक है, और दूसरा मेथड है कि आपका हाथ थंब का जो ये जॉइंट है, इंटरफैलन जॉइंट, इसका यूज करके प्रेस रिलीज प्रेस रिलीज प्रेस रिलीज, स्पेशली द लोअर वन, इसमें आपको यूज करना होता है। तीसरा इसी मर्मा का और एक स्टिमुलेशन मेथड है व्हिच इज tapping on your 3 marma points together. Okay, now the next one is the Mose-Pearl guy. तो हमने नकल को बंद कर लिया, जैसे ऐसे थंब को अपने तरफ रखा, और जो नकल है which is knuckle of your middle finger, so which is we have to hold and pull inwards, and you see how much of a sharp pain it creates. Does it create a sharp pain for you or no? Anybody feels this is very strong? The pain is very strong. How many of your
inwards, like towards yourself?
towards myself.
Okay. Okay.
Now, is there anyone who cannot feel anything?
So you're just picking the knuckle, the middle finger knuckle, and you're pulling the skin, right? Yeah.
Okay.
You get a pain, but then I don't feel anything as such. But there's a pain when you
I
pull.
don't feel any pain.
Yeah. Yeah. Okay.
So I'll show you a little more now. See this area, okay? So this is the upper side. This is the back side, okay? When you close the knuckle like this, not on this part. This is mostly here. On this part, back of the palm. So when you hold with your index finger like this and pull it a little bit towards yourself, it creates a sharp pain.
Yeah. Yeah, that's a pain. Pain is there. Yeah.
You will not feel the same pain on the other ones. You can try and see. It may not be the same pain on the other ones. This one is little different.
Sensitive. It's sensitive to pull. Yeah.
Is there anyone still who could not understood or not felt anything? Okay, so this is on the back of the palm, not on the finger side. This is very, very good. So आप इसका इस्तेमाल whenever like somebody has grabbed you with your hands, somehow you have to just reach and press this point, and they have to release the hands. So this is the use of Mozi Porelkai. You will find patients who are having problem with their palms. They cannot open their palms. Now next point, which is the Kabuli Kalam. The Kabuli Kalam.
Just one correction in the pronunciation, just because I'm from that state.
Yes.
Okay. So this Mozi, the Z that we're using it, right? It's actually L. It's L. Moli. Moli means knuckle. Moli means knuckle. In Tamil, it's called Moli.
Moli.
It's Moli. The Z is pronounced, it's silent, and it's actually Moli.
Right. Okay. So Moli, which means
Moli,
also the knuckle.
Knuckle. And
Very
Piral,
interesting.
the back
Very
side.
interesting. Very
Piral,
interesting.
Piral Kai means the back side. The back side as in the back part of it, not the front, the palm. So it's Moli, knuckle, back side of the hand.
Back side of the hand. Very good.
Okay. Just
very
wanted
interesting. Oh, it's very interesting. So this kind of inputs will be very helpful. Because I see there is a huge possibility in research of this particular subject. So once you at least have some idea, you could go back and find out what probably missing out and what are the more things you can probably add, because obviously, as I said in the beginning, this whole knowledge is in the Siddha system, which is in Tamil or old Tamil. It's not the modern Tamil probably also. The old Tamil.
Siddhas, the Agastya Rishi. Actually,
yes. So it could be a little difficult for us. So maybe you could, find out more and share in the later classes.
I'll do that.
So next one will be your Kabuli Kalam. So Kabuli Kalam. So if you bend your finger, so the here from this is our phalanx, which is ending. Okay. So the inner one. So when you press, release with your 3 fingers, it is activating the Kabuli Kalam 1, 2, 3 together. And also we can do the same thing on the index finger phalange as well. But this is like a very strong energy point because both the fingers are connected here in this area. So pressing this particular point, okay, can relieve the back pain very, very fast. Okay, not even the back pain, but also sciatica pain. So I treated a patient with sciatica pain by putting one needle here. So my teacher used to say, same point, but from this side. Okay, putting one needle here could relieve any strong sciatica pain also from this point. Okay, which is again the combination. So this area is very helpful for your lower back. तो अगर lower back में pain है तो आप इस तरह से प्रेस कर सकते हैं इस एरिया में या तो इस मेथड से, ठीक है, इसमें आपको प्रेशर देने की जरूरत नहीं है, इसमें वेरी जेंटल प्रेशर इज एनफ. Here, if you want to press this, you can do a little extra pressure here. So this is your Kabuli column. Okay. Now Manibandha. Manibandha, आपको बस इसमें हाथ रखना है दोनों साइड में और अपने रिस्ट को घुमाना है. You're not going to do anything else apart from moving the wrist. Notice if the pressure is very strong or weak, and how does it make you feel something? At what level you're feeling something or not feeling anything at all? Okay. And the middle one, obviously, use the interphalange joint to press this area, to press this point, middle one. Now, there's the next one, which is Kafanari Marma. So, Kafanari Marma on the radial side, 4-finger, if I place, so this is exactly somewhere here, we have the Kafanari Marma. So here, we keep the hand in this form and press very gently with your interphalange joint again. 1, 2, 3. And you will see some sensitivity in this point as well, which is the stimulation method for Kafanari Marma. Next one is Theta Marma. So as I said, if this is my forearm, I have to exactly find the middle, which is this. Okay. Now, it is the Theta Marma is on the back side, not on the front side. Okay. So we are not going to go from the back and do the stimulation. Okay. We're not going to go from backwards. You can actually feel, hold and press, and you will see some sensitivity in this point as well. But the method we use to press, we keep the hand like this and turn the wrist. Okay. Now, keeping the fist like this from towards your own side, first keep your thumb over it on the 8th finger level. Okay. Now, see carefully. Okay. See this area. Now I'm turning the wrist. When I'm turning the wrist, my skin is also moving. Okay. Now the Theta Marma on its own come below my thumb. Okay. So when I see this, so this is the point. So if I move my fist, it is going backwards. Then it is easy for me to hold from the front and do the stimulation. Okay. So just moving this fist will bring the point from the back to the front, and you can easily hold it and press it. Okay. So this is the stimulation method for Theta Marma. This is Kurpul in the middle of my elbow line. And also there are 2 points which are 1.5 finger below on both the sides, 1 and 2. Now we can press this with your thumb and the index finger, 1, 2, 3. Point method number 1. Then individual, 1, 2, 3, 1, 2, 3. Then the middle one, 1, 2, 3. All interphalange joint. This area, not the thumb pad or tips. Now the 4th one is together when we do a method which is U-shape movement. So up, down, up, down, up and down. So this is U-shape movement which you have to create over the Kurpul Marma. Now, say you are giving healing to a patient. So you have to imagine that you are holding his right arm with your left hand. Okay, his right arm with your left hand and pressing the theta marma with the thumb of your left hand and holding the कर्पूर marma at the same time with your right hand. Okay, तो दोनों मर्मा जब स्टिमुलेशन एक साथ करोगे तो ये पूरा हाथ का लो, पूरा including the forearm pain, elbow pain, wrist pain, it will cover everything. So this cover all the pain in the lower forearm, including the fingers. Okay, so generally we combine theta and the कर्पूर marma together. Okay, so with this we'll today finish the class. Everyone, please keep your fingers of your right hand over the Adipati Marma. Take few long deep breathing. And close your eyes and remember our gurus, our ancestors, and be grateful for them, towards them, and bring a feeling of gratitude to give us all the knowledge, all the intention to create a positive environment around us, helping people and feeling the real happiness in our mind and soul. Now bring your hands to the prayer mudra. Thank you so much, everyone. What all you should do generally, when you are repeating or going through or revising, okay, तो आप लोग पहले questions बना लोगे and that questions keep it for next class. Okay, so initial 5-10 minutes probably we can use for just a little bit of question answer, and then because it's 10:30 is not a very good time to discuss or do anything. Once we do the stimulation, generally we should do practical. We should just go and sleep. It will give us more better sleep at that moment when we do that. तो उसमें हम बहुत ज्यादा लॉजिकल थिंकिंग नहीं करेंगे उस टाइम पे, और पहले ही हम अगर फिनिश कर देते हैं इसको क्वेश्चन आंसर को, तो इट विल बी नाइस फॉर एवरीबॉडी. एंड ऑल्सो क्या होता है कि आई हैव बीन सीइंग दिस लास्ट फ्यू डेज, आल्सो नोटिस्ड कि सो मेनी पीपल आर नॉट गेटिंग द एक्सेस टू द रिकॉर्डिंग्स. तो आप लोग ऐसा कोई डाउट है तो एक ही साथ में फिनिश कीजिए, क्योंकि एक सुबह मैसेज कर रहा है फिर एक शाम को मैसेज कर रहा है. नो, इट बिकम्स अ वेरी प्रॉब्लमेटिक इफ आई गो थ्रू ऑल दिस अगेन एंड अगेन. ठीक है, और ये हर बैच में होता है कहीं ना कहीं. तो आप लोग कोशिश करो कि सारा जो क्वेश्चंस है, सारा जो प्रॉब्लम्स है, वो एक ही साथ शेयर किया जाए, ताकि और भी ग्रुप में जैसे बहुत सारे लोग हैं उसमें आप टेक्स्ट करते रहोगे, कुछ भी ना कुछ लिखते रहोगे, तो दूसरों को भी प्रॉब्लम होता है जैसे. एंड बिकॉज ऑफ दिस लॉन्ग कन्वर्सेशंस इन द ग्रुप समटाइम्स वी मिस द रियल थिंग व्हिच इज इम्पोर्टेंट. ये मैंने बहुत बार देखा है कि जो एक्चुअल में कुछ इंपॉर्टेंट चीजें हैं वो सब मिस आउट कर देते हैं. जैसे ये जो वीकेंड के बारे में बहुत लोग पूछ रहे थे, आई हैव सेड सो मेनी टाइम्स दैट देयर इज नो क्लास ऑन द वीकेंड, बट देयर आर स्टिल सो मेनी पीपल टेक्स्टेड मी दैट वेदर देयर इज अ क्लास और नॉट, और इवन ग्रुप्स. तो आपको जो इम्पोर्टेंट चीजें हैं वो कोशिश कीजिए कि डोंट मिस आउट. ठीक है ना? चलो, थैंक यू सो मच एवरीबॉडी. थैंक यू. एंड today is 30 people today from 50. Now on the 4th day we have come back to 30. तो आप लोग कोशिश कीजिए कि you don't miss. ठीक है, आप जब मिस करोगे ना तो आपको बहुत लॉस हो जाएगा, मतलब it will be a miss of a lifetime. तो आप लोग कोशिश कीजिए कि 15 दिन के लिए इस एनर्जी को मेंटेन रखें आप लोग, है ना? चलिए, थैंक यू. हरिओम.
Yes, sir.
Well,